All right, hello everybody. Welcome back to my channel. My name is Anthony, and this is Barefaced Beauty. Today, I'm coming at you with another VSG video or an update since the last time. I know it's been a couple weeks since I've talked about my VSG journey, but not much has really changed since the last time, so I didn't really have much to update. But as of now, so today is February 16th that I'm filming this, but February 12th, which was Wednesday, I believe, I actually met with my bariatric surgeon. I had an appointment on Wednesday to meet with the bariatric specialist and also a dietitian on the same day. They were back-to-back appointments, so that was pretty nice. I'll pretty much tell you how it went and what I'm gonna do moving forward. I went to the appointments. Before I met with the bariatric specialist, there was a woman who came in and kind of went over my insurance with me, let me know that luckily my insurance specifically can put me on what they call a fast track, which means that instead of waiting 6 months to be cleared for surgery, I could get cleared in 3 months for surgery, which I thought was pretty cool. She also let me know just kind of like the steps that will need to be taken after this initial appointment with the bariatric specialist and the dietitian, what I would need to do after this day. So she went over that with me, basically told me that after that day's visit, I would need to make another dietitian appointment within a month from that day. And then after that appointment, I would need to make another bariatric specialist appointment a month from that day. So I could not make both appointments the same day again. I couldn't make them the same week, the same month. It had to be 2 separate months, but I had to come back again for both of those appointments. She also let me know that after I go to those appointments, I'll be called by the psychology department, to get evaluated by the psychology department, so that way they can clear me as well. She let me know these things. She also told me that I would have to get PCP clearance, which means that I would need to be cleared for surgery by my primary care provider, and that I would need a barium swallow test. So she let me know these things. She left her number, which was nice, and then she pretty much left the room. After her came in the bariatric specialist. He was a really cool guy. He had a few students with him, which the place I go to always it's a teaching hospital, so they always have a few students with them. So it was like 3 of them in the room at one time. And they came in, and pretty much he started telling me the types of procedures that they recommend and that they offer at this clinic, which for them were the bypass and the VSG, which was perfect because those were the ones that I saw most of anyway when I was doing my own research, was VSG and bypass. So that's something to consider depending on what type of surgery you guys might be looking for in the future. Make sure like it's something that's actually being offered in a lot of places if you don't have an insurance that allows you to go anywhere and everywhere. So he let me know that he was actually kind of leaning towards bypass when we were talking about the surgeries, and I actually had to be the one to kind of let him know that I think I would prefer VSG, just because, you know, depending on what you guys know about bypass and VSG and blah blah blah, bypass, they're actually rerouting like where your food goes. Like they're actually rerouting a few things in there, whereas VSG, they're pretty much just shrinking your stomach, or, you know, eliminating a good portion of your stomach. So it's a little different, you know, and for me, bypass is a little bit more extreme. I did go over the option with him that in the future, if, you know, VSG does not work, or if I have a lot of complications, which, you know, hopefully I don't, that bypass would still be an option, and he did confirm that. So that is something to take note of as well, is that, you know, for most people, if you do VSG and it's not successful for whatever reason, or you have major complications like excessive GERD, stuff like that, in the future you can transition into gastric bypass, and you don't have to jump right to that from the jump. So something to consider. So I did talk to him about that, and he was like, okay, cool, let's do VSG then. Like, he was pretty much on board with it. And I was like, all right then. Only other thing I really asked him was regarding whether it would be an outpatient or inpatient procedure. With my insurance, I will be paying a significant difference whether it's a same-day outpatient versus an inpatient procedure. So I did just want to have a gauge of what it could be. He was honest, and he did tell me that most people do stay a night. But he also told me that, you know, because I'm young and healthy, that as long as I'm drinking enough water and I'm walking, that there's no reason for me to stay in the hospital past that day. So I was like, cool, we're definitely gonna aim for leaving that same day, to cut down on my little out-of-pocket costs. But I'm also not gonna like harm myself. You know what I mean? If I have to stay a night, I'm gonna stay a night. It's okay. Those were the things I asked him, and that's something to consider as well as you go through this journey. If you go through this journey, is cost of inpatient versus overnight stays, talking with your surgeon about what their norm is, and understanding, I think too as well, that everybody's different. So even if you do meet a provider and they're like, or a surgeon and they're like, all my patients leave outpatient, blah, 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 still understand that everybody's different and you might have to stay a night. So be prepared for both. You know what I'm saying? Be prepared for both. I pretty much just wanted to see if outpatient was even an option, you know what I'm saying, before I went into it. So it is for me. Cross your fingers that that's what happens. After I met with him, I met with a dietitian. Now, this was a little interesting. I guess they were running out of time or whatever. I live in a big city and they're always late and everything's always rushed, and so it's something that does happen. But basically, they had a packet for us, and the packet was just overviewing like what our stomachs would be like and our eating would be like after surgery, as well as pre-op. Overviewing like the diets that we'll be doing, the all liquid diets, talking about protein shakes and things that they recommend, stuff like that. You know, talking about carbonated beverages. It was just like the quickest overview of that ever. He basically just read off the sheet, and it was me and one other person in the room, and he was like, all right, you guys got it? And we were like, cool, we got it. And that was pretty much it. It wasn't anything that I hadn't heard before, which was good, but that's also because I did my own research. If you are in a similar situation and you feel like you're rushed in your dietitian session, don't be afraid to speak up. Let them know, like, to slow down if you need them to. Ask questions, you know, because these are the people to ask these questions to. So, but that was my experience. It was a little rushed. I guess they were tight on time. So, went through that. It was pretty straightforward. And yeah, and then I started making some of my appointments to follow up. But like I mentioned earlier, I do need to do like one more dietitian appointment and one more bariatric specialist appointment. So I made those appointments. I scheduled them for, you know, one from 1 month from now and then another from a month from then. So I scheduled those appointments. Also, something I did pretty much right after, I think it was like the next day, I went and I notified my primary care provider that I went through and I had my first consultation. Luckily, my provider is in the same network as the bariatric specialist and all of that, so they're able to kind of see each other's notes through their computer systems, and it's not too hard to transfer information. So I pretty much just let them know to like look and see, you know, the information that was sent about PCP clearance, and to let me know if they need me to go to any other specialty appointments to just get cleared for surgery on their behalf. PCP clearance is a little separate than the bariatric surgeon clearance and psychological clearance and all of that. That's separate. The PCP can still want you to go see cardiology, pulmonology, do a sleep study, I don't know, anything else that they might want you to do. So I kind of want to get that ball rolling if there are a few things that she wants me to do. So I did call them and let them know that. So I'm just waiting back to hear from them to see if they need me to do anything else to get cleared by them. And then I'll schedule those as well. So as of right now, I've had my first initial appointment with a bariatric specialist. He did tell me, you know, I should be cleared in about 3-ish months. So I'm imagining in about 4 months, around June, that I would be able to have surgery, hopefully, that if everything goes smoothly. So I had my first appointment, dietitian and bariatric specialist. I have made my follow-up appointments with both of them. For psychology, remember, they have to call me, so I'm just going to have to wait on that. I have notified my primary care provider, so that way they can let me know if they need me to do anything extra outside of what the surgeon needs me to do. And so, yeah, I mean, you know, that's pretty much where I'm at. I'm glad that I'm getting the process started. It's kind of exciting to like actually have spoke with somebody and have not real dates. Like, I don't have a surgery date, but just even think like this is the first surgery I've ever had. It's a little scary for me. But just thinking like, ooh, in about 4 months I could be having surgery, right? Which means in a year from now, my life could be very different. If you think about how fast a year can go by, it's not that much time. So I don't know, it's kind of exciting to think about. So I'm really happy that I'm getting the process started. I probably won't have an update about this for another month or so because that's when I'll have my next appointment. So I do plan on updating you guys after every appointment so we can kind of see like what information changes, if anything, and what else will be required of me. I'm gonna leave the names of surgeons and dietitians and everybody that I see out for now because I want to make sure that I'm able to get this surgery and be cleared. So when I get this surgery, I will come back and give you more information as to like who I got the surgery done by, where, what dietitian I saw, and all of that to kind of facilitate anybody that might be in my area and is looking for something specific or somebody specific. So I'll come back with that. But, you know, until then, check out for more makeup videos. I'm sure I'll have some more of those coming. I've been playing with more makeup lately, so expect those. And I will see you guys with another VSG update in about a month or so. But if you have any questions, comments, any tips, pointers, if anybody has been through something like this or knows somebody who's been through VSG, please leave them down below. Subscribe, like, and comment if you're liking the random videos that I'm kind of posting. And I will see you guys next time. Bye.